all over there. So we can go ahead and start this meeting. Today is, what is it, November 19th? And happy to have all of you here. Got some new faces, some old faces that we haven't seen in a while, but we appreciate you coming to participate with us tonight. So we're going to try to move this expeditiously as possible. But if you have any questions, please feel free to raise them. I got a few myself. So if I ask them, don't get impatient, because I got some questions. That's all there is to it. Okay, now the next thing is we're going to ask our council if she would call the roll.
Sure, Madam Chairman. McLaughlin.
Here.
Lozano. Beston.
Here.
LaRillier. Here. Kowski. Here. Ricard.
Present.
Robinson. Conway.
Here.
And Curley.
Here.
You have a quorum.
Thank you very much. Can we get approval of the previous minutes? You go along with the agenda. I know it's the first item on the agenda. Now, as I understand, this is our last meeting for the year 2025 because we have other stuff going on in December. Am I correct? So, I wish everybody a happy Thanksgiving and I guess a premature Christmas. But these things that we have on our agenda tonight will move us into 2026. But I just want you to know to be prepared. We're going to do some different kind of work in 2026. Telling you that now, so when the meeting is over and you dash out, you won't be surprised come January. Because we do have some things that we need to talk about as far as elder care is concerned. A lot of things changing in the state, a lot of things changing in the county, but we got to pay more attention. So I'm very passionate about this. Now, so I ask you to just be patient with me. And I'm sure you got some issues as well. So I want you to raise them. We can't just keep going along the way we've been doing because it's too important. And I want to make sure that as we distribute funding, a lot of money rolling through these items that we have here today. And we just got to make sure we are maximizing the effort that is being put before us and the resources that are being put before us. So with that being said, my soapbox, I'm going to ask if we can proceed with the rest of the agenda.
The first item is approving the previous meeting minutes.
Got a motion by Mr. Williard, second by Mr. Beston. All those in favor?
Aye.
Any opposed? Thank you very much.
Item 2 is authorizing an agreement with Dentsply Dental Services regarding dental services for residents of the Shaker Place Rehabilitation and Nursing Center. John Dillon is here.
Thank you all, and good evening.
Where's Mr. Olson?
Well, unfortunately, tonight we also had a family council meeting. So that is the night where family members come in and meet, and we go over all our current statuses and any issues that they may have, so.
Very important. Okay, thank you.
So you guys draw the short straw, how about that? Our first request here is for a contract renewal. DentServ, we originally did a request for proposal for we did a request for proposal for a 3-year contract starting in January of 2022 through December of 2024. That was a 3-year term. We currently asked for one of the extensions or renewals, which the RFP granted 2 renewals. So but the first one we are currently in, and this is the second option for 2026 and the last of the RFP for this vendor.
So it's one of 3, but this is the second.
This is the last one of the RFP, yes. There was the initial 3-year term and then 2 optional 1-year renewals.
Okay, does anybody have any questions regarding this condition? Get a motion? Motion by Mr. Ricard. Second by Mr. Williard. All those in favor?
Aye.
Thank you very much.
Item 3 is authorizing an agreement with Celtic Consulting regarding minimum data set consulting services for the Shaker Place Rehabilitation and Nursing Center.
Thank you, yes. This request is for a 1-year term for Celtic Consulting. They review our MDS submissions and they do consultation with our MDS director, and they review to make sure that our submissions are not only timely, which we currently meet a lot of, but also that the data is correct, because one of the government's not very good when you give them incorrect data and letting you go for it, so you get one shot at it, and we try to be timely with that. This is for $207,500, and the term is from January 1st of '26 through December 31st of '26.
I just have one question on this. How is this training, is this on a quarterly basis?
So an MBS, like you have one done on admission, and then also a full one annually, and also if there's any significant changes per person. So if you have a significant change in your order, like the doctors have a significant change in your status, another one has to be done. That data then needs to be submitted and approved
So
for
it
these.
is, I know it's done on admission, and then throughout the year, there are different time periods where,
Yes,
the whole nursing home is dealt with?
every person. Usually you have it quarterly. If there's no significant changes, it's not a significant update. It doesn't have to be a full review. It can just be partial. But if there's a significant change, and annually,
Okay.
and also annually, sorry.
Thank you. I needed a refresher on that. Anybody else have a question? If not, can I get a motion? Motion by Mr. Ricard, second by Conway. I was about to call you Sullivan.
That's all right.
I'm sorry. All those in favor?
Aye.
Any opposed? Thank you so much. Resolution passes.
Yeah.
Item 4 is amending the 2025 Department of Residential Healthcare Facilities budget for administrative adjustments.
Thank you. And as you can see, there's an attached spreadsheet that's very long and has a lot of changes. But the three large topics on that that we're adjusting here is the overtime, the temporary help, and the contracted services. Each one of those is categories that we've worked on significantly this year. Contracted services was agency, and all that usage is gone. So this is just to shore up for this year's and to get it for the end of the year. Next year, agency is not going to be used, and that we have to go that route. We've made significant strides in our staffing that address the other two, temporary help and overtime lines. Okay? This time last year, in rough numbers, we had roughly in the CNA category alone, we had about 42 FTEs, and we were making up the rest with difference with agency and per diem help. Now, we've significantly reduced that per diem help. We have no agency, and we have close to 100, so we've almost doubled our CNA FTEs. The NATP, Nurse Aid Training Program that Mark, as Director Olson, had got certified earlier this year, has put about 50 CNAs into the community so far, okay? We haven't retained all of those, we're probably in the 30s. You know, there is always turnover. CNAs alone in the industry are around 50% turnover over year. So, but the strides that we're making, trying to go that route to use full-time employees, not contracted, not per diem, not, just line staff. We're making good strides, and we're going to continue. We're going to continue with our, training program, and we're going to continue with the, hopefully going forward with a new space for the training when we do some remodeling going forward.
Any questions? Others? Yes, Madam Chair.
How much do we pay CNAs?
How much do we pay? There's a sliding scale starting at 2060 and going up. Don't quote me directly, but I think it's like 2420. I don't have it directly in front of me. If you need that, I can give you the.
No, and how does that compare with our competitors?
It does well in the community. I think it's on par with the rest, and we do offer a decent benefit package. We do an excellent benefit package, and also ancillary things like the daycare opportunities and stuff of that nature. So, competitive-wise, the pay thing is one thing. So it's one attribute of it. It's hard work. I mean, it's very hard work that people do, and it's long days. So people tend to be, I don't want to say transient in the industry, but people move around a lot. The 50% turnover, that's national average. That's New York average. We're slightly below it, not much better below, but we are below it, and we're gonna work on that. This is the first year of our training program, and hopefully going forward, we made up such a great gap, limiting the agency to 0 and really downing these per diem numbers. Now it's time to work on building that staff of full-time equivalents, full-time employee lines.
What's your, census at the daycare center?
At the daycare, I'd have to, if you want a direct number, I'd have to get that for you. It's somewhere in the 40s, roughly.
And the capacity is?
The capacity is 66, but
Okay.
that doesn't mean there's vacancies necessarily, because you have to have moving up room, right? So if so the age range is 18 to 3 years old, 3 to 4, and then 5-year-olds. Those are the three groups. If somebody's coming to the point where they're at a 3-year-old and they're gonna graduate to in the 3-4 classroom, if they meet those qualifications, you have to have a spot for them so you can transfer them into there. So it's really relieving that up there. And you have to make sure that if going forward that you're making that allowance for people that are on the way.
All right. Thank you so much. Can I get a motion if there's no other questions?
I'll make a motion.
Mr. Beston, second by, can I second?
Captain Sullivan.
Oh. Here we go again.
Sully's good.
You didn't change your name, did you?
Mrs. Sullivan, stuck in my head. Mr. Conway, second. All those in favor? I'm gonna write that down, Mr. Conway, because I think I'm here.
That's all right, I'm not too worried about it.
All those in favor?
Aye.
Any opposed? Thank you so much.
Hey, have a good night.
Number 5.
Item 5 is authorizing an agreement with the New York State Office of the Aging regarding Title IIIB supportive services funding.
Isn't this turning out to be the long goodbye?
Yeah. You again?
Me again. Like Michael Corleone said in Godfather 3. I thought I was out, and then they pulled me back.
Again.
All right. Madam Chair, good evening.
Good evening.
3B.
Yeah.
You read the title, didn't you? Yeah. So do you have anything, does anybody have any questions about this particular resolution? I feel like I want to sign up for this, the supportive services that they're providing here.
So,
Can you
so
set it up?
basically, just to give you a little bit of a better idea of what we're doing here with the supportive services is that we're going to be going in under 5 contracts in 2026. And under that umbrella, we'll be handling in-home contact and support, our legal services, and also our SAD services, the social adult day. So we'll have 5 contracts, 2 of which will be in-home contact and support, 1 will be our legal aid services, and then the 2 will be our SAD providers.
What was the last one?
Our social adult day
Social Adult Day.
program.
I'm just going to share with you, going forward, we're going to ask for, have some conversation about how where they're going, the distribution, and if there's opportunities for us to expand to different areas. I know
Yep.
there's some consistent communities that have really had access to this, and I'd like to see, how we can spread that around, spread the wealth.
Absolutely. The only changes for 26 for SADS will be that we'll have 3 sites, 2 providers, 3 sites. 1 site did close down, but another site was added. So right now, LifePath will be located on Colvin Avenue in Albany, that 1 site, and then the 2 other sites will be through Colony Senior Services, and 1 will be over at Beltram, and then the other one is opening up at Kingfield 2, which is in Waterville, which will kind of complement the shutdown of Cohoes.
And we do bus people. I mean, they have transportation to get there if they need it.
Yep.
That was going to be my question. How do people, do they have access to go from one? If you're in Waterville, I guess it's closer to go to Colony as opposed to trying to come to Colvin Avenue.
That's right.
So
That's why the opening of Waterville will complement the closing of Cohoes.
Cohoes.
Mr. McCarty?
The last thing you said, the Cohoes, I must have missed it. What's closing?
So basically, we have two providers that do our SADS programs,
Yep.
LifePath and Colony
Yep.
Senior Services.
Sure.
And Colony just opened up a site in Kingfield too. And LifePath had two sites, one in Albany on Colvin Avenue, and the other site was in Cohoes.
Okay.
And they're shutting Cohoes down and moving it and merging it into Albany
Okay.
due to lack of participation.
By individuals?
Yes.
Yeah.
Yeah.
Okay. How many were participating, you know?
I think they had two.
Oh, well, that's understandable.
Yeah, that qualified for our program. So they closed it down, merged it with Albany, and there is one person that the caregiving, the family, it's better off that they, instead of going to Albany, they can drop them off right at Kingfield too.
Okay. Thank you. Thank you.
Yeah.
What's the average capacity at these sites?
Roughly, for our members, we're roughly seeing about, well, Cohoes had about 2, but we're roughly seeing about 10, 12 that qualify for our program. Some of the people that go to these sites are basically private pay.
Private pay?
Or private pay, yeah.
Any other questions? Mr. Aurelio?
Yes, hi, I just had a question about legal aid and the legal services it provides. I know that the grant doesn't specify income eligibility, right? Anyone who's a senior can obtain that.
That's right.
And is it set up that legal aid is just getting the money, or is it funding a specific position for senior legal services?
It's broken down into several categories, but we RFP'd this year, and we only got one response, and that was Legal Aid of Northeastern New York. So we awarded them the contract. They roughly see about 200 seniors for legal services, but reach out to a lot more because they do a lot of our outreach.
Okay.
And then, obviously, they're located at 95 Central Avenue, so a senior could go down to 95 Central Avenue, but they also have 7 sites throughout Albany County that once a month they're located at, and they can see walk-ins.
So people
schedule
make an
appointments.
appointment
Yeah,
to go there. I mean, they do a yeoman's job for us, I'll say that.
Yeah, I had a couple of constituents who I actually suggested to reach out to legal aid, and some of the response time wasn't like same day. So I was wondering, are they obligated, you know, to do an intake for everybody?
They do,
Okay.
do.
they do, yep.
And who's the?
And we
is-
basically have, I think there's basically 2 staff members that are designated to this contract.
Okay, so, and
Two
I know
attorneys.
I reached out to Nick Rangel,
Yep.
the head of legal aid.
Yeah, she's the head.
Right, but I was just wondering if you had the contact person. who
Ann
does-
Yes.
Malik. Ann Malik
Malik.
would be
Ann
the
Malik?
person, yeah.
Okay, thank you.
And I probably can give you that number offline,
Thank you.
so you can use that number.
Thank you.
There's no more questions, can I get a motion for number 5?
Make a motion.
Motion by Mr. Besson, second by Ms. Plotkin. All those in favor?
Aye.
Aye. Thank you so much.
Item 6 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-C1 Congregate Meals Program.
So again, this is just a request to accept money from New York State Office for Aging for our congregate meal program. And in this case, the grant award is for $408,000 and change.
Any questions? Now, these are some of the things that we're gonna be talking about in the coming year, so I just want you to be prepared to help us out, to get finances and helping us move this, expand this a little further.
We have expanded it this year. We have 25 sites right now, 7 providers, so we RFP this every year. And this year, we awarded everyone that submitted a proposal. So we have 7 contracts, 25 sites. We added 2 sites this year that will go into 26. Islam Senior Center is one, and the other will be, is Westerlo,
Rest of them?
yes, in addition.
I'm glad to see you're out in the hill towns, and because people think that sometimes they don't have the same needs as you might have in the inner city or the urban areas, but I tend to think it may be more harsh in terms of what people need, so thank you for sharing that. Can I get a motion?
Motion.
Motion by Mr. Ricard, second by Ms. Plosky. All those in favor?
Aye.
Aye, thank you so much. Number 7.
Item 7 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-C2 Home Delivered Meal Program.
So again, this is to accept money. It's $278,000 and change. We have, I think, four
providers.
providers who do home-delivered meals. And we're, it's,
Do these areas overlap in terms, as I look at the congregate meals, the home delivered meals, are the cities,
Well-
towns, are they overlapping with these programs? or
no,
is there a
because
distinction?
congregate meal is separate. You have to be able-bodied to get to a congregate meal.
Mhm.
Home-delivered meal is because you are not, that you need somebody to bring a meal to you because you have no one who's gonna provide a meal for you, you
Right.
can't get out. It's not that, you're waiting for your meal and then you go over to John Paul and get your hair done. This is it, you can't get out. Sometimes we have people on a temporary basis because they just got out of the hospital and they need somebody, matter of fact, we have one of those coming up this week. And they need it for a certain amount of time until they can get in, home care or whatever it is that they need to take care of them. We have a pretty robust group that is getting home-delivered meals.
Right now, we have 4 providers.
Yeah,
3 of them are separated by zone. So we have 5 zones in Albany County, which is not, it doesn't conflict with Congress because they're 2 different programs. But the 5 zones, the 3 of them take care of them. That's Altamont program, which is Peter Young, Life Path, and Ravina. And the 4th one is Jewish Family Services, and they handle the whole entire county because they handle the kosher home delivered meal.
Yeah, because I wasn't really concerned about the individuals overlapping as I was about the areas that were being covered. So-
well, if you're going to a congregate meal, you are not eligible for home-delivered meal. You can't do both.
Yeah, I know, I get that,
Yeah.
and I appreciate that understanding, but my point is, and I think, do you all understand what I'm asking? That if you're concentrating, I don't know, let's say you're in Bern, and you're doing a lot of the congregate meals there. Is Bern also getting a disproportionate number of home delivered meals? That's the point I'm trying to make. Not the individual, but I'm looking at where are the services. This is the kind of questions that we'll have in the future. You don't have to answer it today, but I'm just trying to tell you, I just want to be clear on that there is not the overlap of the service that's being provided and one area getting more service than others. Do you understand what I'm saying? If you're getting everything and these people over here get nothing, I just want to be clear
Well,
about
they're
it.
just meeting demand as calls come in for this, right?
But
And for a home-delivered meal, you have to qualify for it. I mean, you can't just say, I'm gonna stop by and drop off a meal.
Okay, but I won't belabor the issue, but, it's tonight, but I will be bringing it up in the new year, so, and it is as need occurs, I understand that, I see a name of a hand.
Just a question, so if a senior qualifies for home delivery meal, regardless of where they are, and if they're out in Preston Hollow and there's one person, the county.
Will we go there? Yes.
Madam Chair has a question.
So it's income, you have to qualify income, and you also, does the volume of requests exceed the capacity that we have? Or
No,
every
not
call-
now, no.
Okay, so anybody who calls and meets the criteria, on the income side as
I don't
well
think it's
as the
income, is
need
it?
side.
It's not.
Gets a
It's
meal.
not income.
It's not income. It's
Oh,
be,
okay.
it's
It's
an
need.
MDS, it's a medical assessment
Okay.
that they go through.
Yeah.
So they call into New York Connects.
Okay.
They get referred. We have an MOU with DSS
Okay.
that handles
So
all.
they determine that they are, their
Eligible.
ADLs or whatever,
Yep.
make them
Yes.
qualified to receive the home delivered meal.
Yes.
The only time we had that situation, and NYSOFA took care of it, was during COVID,
Okay.
because you couldn't have the congregate meal
Right.
happen. So then what they did was they rolled it over to either home delivered or a grab and go, and that was it. And so then you saw a spike in the home delivered meal, and I think we probably talked about that. But yes, we would go to Preston Home.
Thank you. With this empty and over questions, can I get a motion? Motion by Ms. Williard, second by Ms. Kowski. All those in favor?
Aye.
Thank you. Resolution number 8.
Eighth is authorizing an agreement with the New York State Office for the Aging regarding the Title III-D medication management program.
Sure. So 3D is our evidence-based program grant that we have one contract going into 2026. It's with LifePath, and they're going to be handling our aging mastery program. And New York Connect, or basically NYSOFA, has kind of loosened up the qualifications to qualify for an evidence-based. It used to be where they had a list of evidence-based programs that you had to be part of one of those, and there was like a list of 50. And if you didn't qualify, you didn't get the contract. So aging mastery is one of them on the list, but if there's anything that we feel that would, the seniors would like or would, prosper from, we could go to NYSOFA and introduce it to them, and then they would okay it for us.
Which, by the way, we did when we had Senior Hope.
Yep.
We took that, Senior Hope took care of elderly that were addicted to different things besides alcohol. And we went to them with that idea of Senior Hope and belonging to that. And NYSOFA went with it and added it to their list. So we did introduce that.
Thank you. And if there are no other questions, can I get a
Make a
motion?
motion.
Motion by Mr.
Second.
Westman, second by, I saw 2 hands open, by Mr. Ricard. All those in favor?
Aye.
Any opposed? Thank you so much. Number 9.
9 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-E caregiver support program.
So we have somebody who does caregiver support for us in our office. This is not something new to us, and we do that. I think that we're probably going to see an increase now in caregivers who will be using the program and asking for support, because we've kind of made kind of a quasi arrangement, collaboration with the Parkinson's Foundation. And we want to be able to support, I mean, they're very good about having their own care support, but we want to be able to support. They opened up yesterday their new well, not a foundation, their new gym, yes, their new Parkinson's gym. And I think that's something we really want to be on the ground floor with. That just opened up. I'd like to see us, because we do have good transportation money, I'd like us to be able to run a bus that would take people to that center, because if you have Parkinson's, you need to be moving. That's the thing, you need to be moving. And this gym that opened up yesterday was just phenomenal. And it's in the old Y building, it's on Wolf Road, it's in Colony. And they got a wonderful turnout yesterday for their opening. And I think it's going to be pretty terrific. And I would really love it if our office could be on the ground floor helping with that effort to get people there. And that's for something that you can talk about after the first of the year, too.
And you don't have to be a part of a caregiver program that the county, if I'm a caregiver at home, I have somebody that has Parkinson's, I can call up and ask, and get that service? Or do I have to be affiliated with the Y?
Well,
or-
no, you don't have to be affiliated with the Y. No, no,
Well,
that's
provide-
a standalone.
Yeah, you can attend this
Program.
program at this Y location for free for people with Parkinson's, and they're very okay.
It's wonderful. I really hope that you will take that under advisement and really work with that, because it's a wonderful program. They're doing wonderful work. You know, they do give a lot of support to their caregivers. But I would love it if we could be more involved with that too.
I know that the director of the Y was very excited about it in his comments. Dave Brown.
Oh, yeah.
So.
And just to add, under this 3E caregiver support, we do have a total of 5 providers
Yeah.
that do this in Albany County, that provide respite to caregivers. It also, this also qualifies for SADS, our Social Adult Day, caregiver training, and caregiver counseling. And we have a department, we have an MOU with DSS that handles our PERS program, which is the personal response button.
Mhm.
So we have a total of 6 under this grant money.
Thank you. Yes, Mr. Ricard.
Thank you, Madam Chair. Just a quick question. It mentions 60 on here. I know people in my sphere of influence that are in their 50s, or sometimes younger, that are unfortunately have Parkinson's and situations like that. Is there any way they could get the help?
Well,
Yeah, it would fall
the
under-
Parkinson's is a brand-new program.
Okay.
Yeah.
That doesn't fall under this right now.
Okay,
Our 3E program is basically 60+.
okay.
You have to be 60 years and older. And it's respite for, it really is not really about the individual older adult, it's about the caregiver.
It's about the person who takes care of it.
That's caregiving.
To my point though, there is a lot of people in my age group that are taking care of elderly parents. So I'm 58, so not that I want any assistance, but I'm just trying to make the point. How would you help an individual with
No,
my
but
age?
you would qualify because you're the caregiver. The caregiver doesn't have to be 60.
Okay.
The individual is 60+.
The individual's got a 60.
Yes.
And truth in advertising, my daughter, 45 years old, has just been diagnosed with early onset Parkinson's disease. So you are correct.
Thank
It
you.
happens to young.
I wish I wasn't. I'm sorry to hear that.
Yeah, but she's doing great. Thank you.
Good.
Thank you.
Can I get a motion?
Motion.
Mr. Ricard, Ms. Kowalski, thank you so much. All those in favor?
Aye.
Thank you very much. Number 10.
Item 10 is authorizing an agreement with the New York State Office for the Aging regarding unmet needs.
Well, unmet need is my favorite thing that we have. And this year, we're getting a lot of money for unmet needs. So that permits us to go out and do a lot of things and start up maybe some new things that I have some great ideas about. And, the money is there to specifically help either with, helping people get food or some other kind of, maybe I'd like to see shelter included in it. So unmet need was given to us. It was started, several years ago by Governor Cuomo, actually, who put it into his budget. And this governor has carried it on. And this year, we have qualified for twice the money that we've ever gotten before. So I'm very excited about it, and it will serve our seniors well.
Any questions? If not, can I get a motion?
I make a motion.
Motion by Mr. Veston, second by Ms. Kowalski. All those in favor?
Thank
Thank you very much. Number 11.
Item 11 is authorizing agreements with the New York State Office for the Aging and the Albany Department of Social Services regarding the Nutrition Services Incentive Program.
This is a nutrition incentive program, and Alec can speak to that because it's really about it's money that's being used for homegrown
foods, basically. So it's in addition to congregate and home delivered meals, basically monies that we receive. So that money goes towards those programs, basically.
Like farm to table kinds of stuff, and
while we were going through the shutdown,
Yeah.
people were, did you see an uptick in requests for services from seniors? Particularly as related to.
Well, we saw an uptick, about food.
Right, that's what.
Yeah, we saw an uptick about food, that, people, because they couldn't go out, if you remember Price Chopper would let seniors have an hour in the market by themselves, but it was at 6 o'clock in the morning. I'm still on an Ambien buzz at 6 o'clock in the morning, so I wasn't there. But we saw that, but again, you gotta remember, people were being sequestered into certain places, and I will say it again, the ace in our pocket for all of that was Diane Conroy Lasavita at the Beltron, because it never mattered what time of day or night I called her, that commissary opened up, and if she had to deliver the food herself, she did it. And we were in much better shape than a lot of other counties regarding that, because we really hit the ground running with that. Pat Alderson was very good about calling and requesting things from us, and we were able to work really quickly with her. LifePath also was a big help during that time, but we saw requests for food kinds of things, because you couldn't gather. So, being able to go to a center or anything like that, it wasn't happening, we were all closed down.
Well, thank you for that. Thank you for meeting those needs of people throughout Albany County. Appreciate all the work that you do and look forward to continuing to work with you. And thank you so much for your service with the Department of Aging. And we look forward to continuing to interact with you as well in your new capacity.
Thank you.
So much. for all
Right,
you
catch
do.
me on my comeback tour.
Can we get a motion to adjourn?
We can do a motion on that.
Oh, sorry.
I'll make a motion on that. Second.
Whatever your name is.
Yes.
Whatever.
Whatever his name is. let me
Mr.
take it.
Carter and Mr. Sullivan.
Yeah.
Mr. Sullivan.
Hey, hey, you.
All in favor?
It's all Mr. Sullivan's.
Motion to adjourn. Oh, I'm sorry. That wasn't the adjourn motion.
Oh, okay.
Now can I get a motion to adjourn?
There we go.
Mr. Ricard, Mr. Conrad, thank you so much. All in favor?
Good for you.
Motion passes.